Hello everyone. I know that most of you in here know what pressure sore is caused from pressure, right? Well, let me ask you this. Have you ever seen a wound like on an ankle that when the resident moves their heel or their foot, that you can see the tendon moving? One way to have a chance for a wound like this to heal is to use a wound vac. According to Ignatavius and Workman, the authors of Medical Surgical Nursing, 5th edition, a vacuum-assisted wound closure has been used successfully to reduce or even close chronic ulcers by enhancing the formation of granulation tissue. I will explain the stages of wounds, what a wound vac is, and how a wound vac plays in part of wound healing. What is a pressure ulcer? According to Tibia, Scherer, and Smith, the authors of Introductory of Medical Surgical Nursing, 7th edition, the definition of a pressure ulcer is also known as a decubitus ulcer and occurs when the capillary blood flow to the area has been reduced. The 4 stages of ulcers are, according to Wilson and Gideons, the authors of Health Assessment of Nursing Practice, 3rd edition, the definition of a Stage 1 ulcer is observable pressure-related alteration of intact skin whose indicators as compared to an adjacent or opposite area of the body may include changes in one or more of the following: skin temperature, warmth or coolness, tissue consistency, firm or boggy feel. Sensation is pain and itching. The ulcer appears as a defined area of persistent redness in lightly pigmented skin, whereas in darker skin tones the ulcer may appear with persistent red, blue, or purple hue. According to Wilson and Gideons, the authors of Health Association of Nursing Practice, 3rd edition, the definition of a Stage 2 pressure ulcer is partial thickness skin loss involving epidermis, dermis, or both. The ulcer is superficial and appears clinical as an abrasion, blister, or a shallow crater. According to Wilson, Gideons, and the author of Health Assessment for Nursing Practice, 3rd edition, the definition of a Stage 3 ulcer is full thickness skin loss involvement, damage, or necrosis of subcutaneous tissue that may extend down but not through the underlying fascia. The ulcer manifests clinically as a deep crater with or without undermining of adjacent tissue. According to Wilson and Gideons, the author of Health Association of Nursing Practice, 3rd edition, the definition of a Stage 4 ulcer is full thickness skin loss with extensive destruction, tissue necrosis, or damage to the muscle, bone, or supporting structures, tendons, or joint capsule. Undermining and sinus tracts may also be associated with the Stage 4 pressure ulcers. Now I've explained the 4 stages of pressure ulcer, let me tell you about wound vacs. According to Ignatavius and Workman, the authors of Medical Surgical Nursing, 5th edition, vacuum-assisted wound closures have been used successfully to reduce or close chronic ulcers by enhancing the formation of granulation tissue. The companies at the building that I work in, KCI and McKesson, are 2 of the suppliers that supply wound vacs. Now that you know what a wound vac is, let me explain to you how it assists in wound healing. According to Ignatavius and Workman, the authors of Medical Surgical Nursing, 5th edition, this technique requires that a suction tube is connected to a surgical sponge and sealed in place for 48 hours. During the time, continuous low-level negative pressure is applied through the suction tube. Duration of the treatment is determined by the wound's response. So in conclusion, it's helpful to assist with wounds healing by bringing blood flow to the ulcer and increasing granulation tissue. I have talked to you today about wounds and their stages, the wound vac, and how it assists in wound healing. So just remember that when you hear someone talk about a nasty wound, you'll now know that a wound vac may be appropriate. Thank you.